Hello again. If you don't know, my name is Cheyenne. I'm making these videos to document my journey with triple negative breast cancer. In my last video, I talked about my diagnosis and everything leading up to right before I started chemo. And I want to focus with this video on my chemo treatments and the side effects and everything that entails. Now, before I started chemo, I would say probably just a few days before, I had to get a port placed. I don't know if you can actually see it. You can see the scar right here. I'll also do some pictures with this video. But the port is used so that they don't have to try to find a vein. I know some people, it's harder to find a vein and draw blood from that. It's also safer. With the one chemo medication that I had, if it escapes the vein, it can actually burn and eat away at the skin. I looked up pictures, which I don't recommend, but it almost reminded me of somebody that had a snake bite. So it minimizes the risks of that happening also. I was extremely nervous about getting the port placed for some reason. It was all making it much more real, but it wasn't that bad. So I started my chemo treatments on July 8th, and the chemo medications that I was going to be getting was it's actually called the ACT treatment, and it's the normal standard chemo treatment for breast cancer. The first chemo med, doxorubicin or adriamycin, and Cytoxan would be the first chemo meds that I would be getting, and it would be bi-weekly. I would be getting my treatment every 2 weeks on Wednesday for 4 rounds. And then after that was finished, I would be going in weekly for Taxol. And later on, they would actually add to the Taxol a medication called carboplatin and also an immunotherapy called Keytruda. So, port placed, the first day that I show up for chemo, obviously I'm extremely nervous, freaking out. I honestly didn't think I could go through with it. I watched a bunch of videos, and I mean, that's another reason besides documenting this. I'm making these videos so that women can get sort of an idea of how everything goes. And I mean, everybody has their own journey to go through, but to get sort of an idea and an understanding, because I knew nothing about chemo, and it is nerve-wracking. And I had my cousin to guide me through because she had been diagnosed with breast cancer just a year before I had. So I was really lucky in that sense to have somebody guiding me through, and that's what I want to do for others. So I go in, port placed, go for my treatment. My husband came with me for the first treatment. Now, I didn't know this at the time, but they can actually give you a cream to put on the port to numb it before they stick the needle in there. So the first time around, pretty painful. So if you're going to have chemo treatment before your first one, just ask them for the numbing cream to numb the port. Now, the treatments are tailored especially to you for height, weight, and such. So every time you go in, they actually draw blood from the port, check everything, check to make sure your numbers are all good before they do the chemo. And then they send you downstairs and start the chemo treatment. And the chemo treatments were pretty long. They actually said it would be about 4 hours each time I went in, but it ranged anywhere from, I would say, 4 all the way up to 8 hours sometimes. It's all depending on how fast the pharmacy moved, because like I said, they have to mix and get all the chemo medicines ready for you specifically. I was a nervous wreck, and the first two medications that they gave me was the adriamycin and the cytoxin. The adriamycin actually had to be administered by a nurse in a big syringe that they had attached right to the port, and she actually had to sit and push it in. She had about 5 to 10 minutes to actually get as much as she could in. As far as I know, the reason that they do that is the longer it goes, the more of a chance there is of that escaping the vein, and that was the medication. That's really nasty. They actually have the nickname for it, the Red Devil, because of its color, and it's actually the strongest chemo meds I think that they have, because it kills cancer at every point in its life cycle. It's the one that can make you extremely nauseous. Obviously, you lose your hair, your white blood cell counts can dip very low. You have more of a chance of getting infections and just really nasty side effects. The reason you get all those side effects is because it, along with killing the cancer cells, it kills any fast growing cells. So along with killing the cancer cells, it does kill some of your good cells like hair. I noticed that my taste buds completely a mess, and everything tasted extremely gross, smelled really gross. But that was the least problematic side effect. So when I go down to the treatment, I wasn't sure what to expect. I wasn't sure if you had treatments like in a group setting along with other people. I know where I went, it was open, but you were all in your own little cubicles. Once in a while, I would be in a room on my own, but for the most part, I was in that open setting in my own little cubicle with a reclining chair and a TV. And I mean, the nurses are godsend. They're amazing. I don't know how they do it. I would not be able to do what they do, and they just are super sweet. Anything you need, and they're there for you the whole time. When you get your first couple treatments, they do sit with you for the first 15-20 minutes just to make sure you don't have any sort of reaction to the medication. Because of how nasty those meds can be, they actually give you pre-meds, which they give you a couple different types of anti-nausea medicine. I know they gave me Benadryl, and then they wait about a half hour before they actually start the infusion. Now, I said the adriamycin was something that she had to actually administer by hand. The cytoxin, they set up a machine, and that was infused, I think, over an hour period. So go in, blood drawn, they check your numbers, go downstairs, and a lot of waiting for the pharmacy to mix your chemo meds, get those ready. Once those are ready, they hook you up in a couple hours, and then they actually watch you for a little bit afterwards, take all your vitals, and you're good to go. The first night after chemo, I know that when I first was done with chemo, after everything, I was really dizzy and lightheaded and tired because of the Benadryl that they give you. I went home and slept for a little bit, And I actually tried to hold my daughter, and it wasn't a good idea because of how dizzy and just how out of it I felt. So I ended up going to bed really early, and I woke up about 2, 3 o'clock in the morning. At that time, I was feeling not great, almost like I was coming down with a cold. Um, I think the nervousness, I mean, made it so I couldn't sleep well that night. But I go back to sleep maybe around 4, and when I woke up, because I had to wake up and go in at 8:30 a.m. to get a shot after every treatment. I'd have to go in the following morning to get a shot to raise my white blood cell count. When I woke up to go in and get that shot, I felt like I had been hit by a truck. I felt awful. It was like the worst, felt like the worst hangover mixed with the worst cold. And I was just cursing them up and down for making me get up so early to go in and get that shot right after having the treatment. I mean, luckily they give you anti-nausea meds to take home, and that really helped me not throw up. I would get nauseous, but I never actually threw up from the chemo meds. And I was really lucky in that because about 60% of people do have that side effect. When you get the chemo, it's usually about 2 rounds before your hair starts to come out. And I didn't want to wait around and watch my hair come out in clumps. So what I did is right before I started chemo, I gave myself a cute little short haircut because I had wanted to try it for a long time um, to sort of help me along and not make me feel as bad about it. So I did the short haircut, and then after my first round of chemo, I was super scared, but I had my husband shave my head. And I was really devastated about losing my hair. And I know it sounds silly when you're facing cancer and, you're facing, life and death situation, and I'm worried about my hair. But it's a big thing to have to deal with. And it hurts. I mean, along with everything else. So I shaved my head because I didn't want to sit there and watch clumps of my hair come out. So for a couple days after my first round, I just felt really down, really tired, sick, achy, and it did get better after a few days. Now, some people don't feel the effects of the chemo. It doesn't hit them for a few days after treatment. Now, with me, it hit me immediately the next day and started to subside after about 3 days. And what really, really helps through that is drinking a lot of water to flush the chemo through your system as fast as possible. I know they recommended as much fluids as you could take in. It would help, really help those side effects subside. After the first round, that's really what hit me the hardest. And the second round, I was extremely scared of because of how hard that first round hit me. But I didn't get quite as sick the second round. I think my body was used to feeling crappy by that time. So I felt a little crappy, but it wasn't, it was easier to deal with. Now, after the 4 rounds of the adriamycin and the Cytoxin, I started Taxol. That was the one that I was getting weekly for 12 rounds of that. That wasn't as bad side effect wise. The biggest thing with that was peripheral neuropathy. numbness in my fingers and toes, which didn't happen until like 6 or 7 rounds in. And it wasn't painful for me. It was more annoying than anything else. What was extremely nerve-wracking about the Taxol is I remember walking in for my first treatment of that, and I saw a crash cart, basically. And I was like, what is this here for? And when the nurse came in, I'm like, why is this set up here? And she was like, well, if anything happens with this, it happens in the first 15 minutes, so we want to be prepared. She's like, and we actually sit in and watch you with this medication. Same thing, they gave you pre-meds and everything. That can go really wrong really quick with that medication. So that was extremely scary. That went pretty well. The 12 rounds, I mean, once you're used to it and you're in the rhythm, it actually starts to go by extremely quick. I had 6 months of chemotherapy altogether, and like I said before, I was going to go with the lumpectomy, but about a month away from surgery time, I decided that I was just going to go with the bilateral mastectomy. There was only a 1% difference in the cancer returning between the lumpectomy and the mastectomy, but 1% difference is a 1% difference, and I just wanted to have them removed and have the reconstruction surgery. So in January of 2021, I had my bilateral mastectomy, and they put the expanders in right then and there to start the reconstruction surgery. I had my scans and everything after the surgery, after I healed up a little bit. The results were good, but then there was a little bit of bad news. When they got the cancer with clean margins, which was amazing, but they had found out that the chemotherapy had not touched the cancer at all. It hadn't shrunk it. The only thing it did was prevent it from spreading. Now, I forgot to tell you that after chemotherapy, they give you a month off to recover from the chemo before they actually do your surgery. They want your white blood cell counts and everything to raise to minimize the risk of infection. In just that 1 month of not having chemo, the cancer had spread from the breast to 2 out of my 14 lymph nodes. When they removed the cancer, they did remove all the lymph nodes. Like I said, it had spread to 2. I mean, that's how aggressive the cancer was. So, unfortunately, after the mastectomy and the reconstruction, I ended up having the side where they took the cancer, there was necrosis and dead skin, so they ended up having to take the expander out. And they're still not done with the reconstruction. I still have to get the implant put in, but the left side, I just used a prosthetic, and I'm only getting the implant on the right side. But I've learned to deal with it, and it's not a big deal in the grand scheme of things. Now, I'm currently still going through treatments because, like I said, because of the chemo not touching the cancer at all and changing it in any way, they consider, even though they got it with clean margins, they consider me having residual cancer, meaning they think that I have microscopic cancer cells that they can't see sort of floating around that could attach to something. So I got radiation after my mastectomy, and as of right now, 1 year and 4 months past surgery, I'm actually on the chemo pill, which is way easier and way better than the IV chemo. Obviously, I don't lose my hair from it, and I don't get nearly as sick, just a little bit tired, and maybe a tiny bit of numbness in my fingers and toes, but nothing like the IV chemo. I'm doing really good though. I'm in a good place, and I'm still going to continue to document more of the stuff that I went through in the next video. Probably talk about radiation a little bit more in depth and talk about what comes after it's all done, because it after everything was done and everything quieted down, it seemed to hit me a lot harder. So I wanted to discuss that further. But thank you again for your time, and I will make another video shortly. Have a good night.